tell us what you know based on your expertise in terms of vaccine effectiveness, because it does sound, with so many different vaccine trials in the works, I mean, there's a lot of optimism we will get one, but Dr. Anthony Fauci was among those talking about the fact that the chance of it being very highly effective, I should say, meaning 98% or more guaranteed protection, is not great. Would you agree?
Definitely. There are so many unknowns. We don't know if we will actually be able to achieve a vaccine. We certainly know that the current antibodies wane over months. So there's not much point in having a vaccine that you have to have every 6 months, for example. So there are many unknowns. We don't know if the vaccine does work, how long it will last for. We don't know how it'll affect different age groups. The early trials suggest that the elderly don't respond as well. And of course, they're the people we would most like to give it to. So we don't know if there's going to be reactions in people, or especially in children. So there are a lot of unknowns, yeah.
No, indeed, there are a lot of unknowns. And I think one of the other unknowns there, Professor, is, of course, how poor countries try to catch up in really dealing with this crisis. And you're citing the example of Africa, South America, and the Middle East, which can be in a spot of bother, tackling this issue.
Well, you'd have to say that COVID could be described as the great revealer. And any country that doesn't have strong health systems, or it doesn't have strong leadership, it doesn't have great community cohesion, then a lot of these countries are being exposed. We can see the problems with nursing homes in Victoria, for instance. We can see the buy-in around the world in Western countries to masks. So there's a lot of behavioural problems in different countries and not just behavioural, but communication problems where that buy-in between leaders and community is missing. So I think this is a big problem around the world that's being underestimated.